There you go. Good morning, everybody, and welcome to our live bonus Friday session of Ask a Doctor, where you can post your questions off into the chat area of the video, and Dr. Ellithorpe will answer your questions. I do want to say, of course, that this is not meant to replace your relationship with your doctor. This is not practicing medicine over YouTube, but this is for education and learning. How would Dr. Ellithorpe answer these questions if she was asked a similar question by a patient standing in front of you? There's no replacement for your doctor knowing you, your history, your medications, your background. So let's all learn together and answer some questions. You can also post a question anytime. It doesn't have to be just during these live YouTube streams. If you look under the description of the video, there's a link there to a form where you can post your question, and we go through those questions and answer those. And the best way to stay on top of what's going on here is, of course, to subscribe to the channel. If you're getting value out of this and you appreciate this, hit that like button as well, too. You can go to our website and sign up for our newsletter as well, too, so that we send information out to our patients there, too. And the blog, right? We're transcribing these videos and creating a blog post with all of the questions, and you can quickly read over and learn, and we can all grow together.
And they can kind of pick and choose what questions might intrigue them to a problem or a concern they have, rather than have to go through a whole audio video to look at that. Exactly. So hopefully that'll be a help to you and your family and friends.
And it's a help to us and our patients and our audience as well, too, because what we're using that form for is now capturing these questions, categorizing them, and we're going to build some resources, some future videos and courses out of this content, some blog articles, maybe some white papers, so that you can go straight to a subject that interests you and hear all of the answers put together well in a format to learn from.
Yeah.
Sound good?
Yeah.
All right. Well, I know that you had a question that started off in the chat a week or so ago. Maybe it was even on Monday, where a patient had mentioned something about colloidal silver, an article, an FDA warning, and they emailed that article to you. You had some time to take a look at that. Do you want to review that, paraphrase what the question was, and then get that answered?
Yes, one of the people sent this in, and from Ophelia, Ophelia, and she was looking at colloidal silver. And what we have here at Tustin Longevity Center is not colloidal silver. It is nanoparticulate silver, which is a much more evenly dispersed, finer particulate in the water called Argentine silver. Only at a doctor's office can you get the Argentine silver. If you go to the health food store, you can maybe see a half string.
The Sovereign silver.
Sovereign, is that the name? Sovereign silver is what's available over the counter, but it's half the strength. Nevertheless, it's very good. And so her question is, she's concerned about learning about Argyria. Argyria is, there's the blue man. Some man was making his own colloidal silver with homemade materials and producing his liquid silver as his general antibiotic, antiviral, antifungal home solution. And he used this and ingested it daily and daily over years. And his homemade solution of colloidal silver deposited the silver into his skin, and he now looks blue. So he's the blue man. If you go on YouTube and you put the blue man, you'll see his picture there. Now, this cannot happen with Argentine silver, and so the concern does not apply to Argentine. So when I use Argentine over the past, how long have we had Argentine?
Oh, at least 10 years.
10 years, yeah.
Right. And before that, we did use colloidal silver, which can be used safely with moderation.
Right.
But this is a silver hydrosol.
Correct. So I've been ingesting Argentine silver. When I brush my teeth in the morning, I will take a sip out of my bottle. I have a little 8-ounce that I put in my medicine cabinet. I brush my teeth and then rinse my mouth. I'll take a tiny sip out of my own labeled R for Rita, and I take a sip, I swish around, and then I swallow it. So I'm doing this morning and evening, probably a teaspoon, and I have for over 10 years, and I'm not blue. So there are differences in chemistry. I was a chemist before I was a doctor. And so the colloidal silver does have a concern, especially homemade, has no regulation or controls, and you have to be careful with it. So hopefully, Ophi, that answers your question.
Yep. We have the hydrosol silvers, which is in a completely different category. And if you look at a hydrosol silver under electron microscope, you will not see the clumping, the large clusters of silver like you'll see in a colloidal silver. It's created in a different way. They both have silver as the active ingredient, and silver has been used for thousands of years to purify, to clean, as an antiseptic. They would use them in water systems to keep the water clean. And it's my understanding that even that argyria, that it isn't necessarily there's no harm in it. It's just obviously an unattractive look. You don't want your skin turning blue, but there aren't health risks per se from that.
Correct. The phrase "he was born with a silver spoon in his mouth," that comes from thousands of years that the wealthy always knew that if you take silver and you use it in your utensils every day, you're getting a tiny amount of antibacterial, antiviral, antifungal, so that your daily health is supported by using silver, actual real silver material in your utensils. And only the wealthy could afford it, so the wealthier remained healthier. The other thing I was going to say about silver and throughout the centuries is if you take a silver coin and you take 2 glasses of milk, and then you take 2 glasses of milk, put it in one of the glasses of milk, and you come back 3 days later in room temperature, the one that did not have the silver in it will have clumped up and separated out, and you'll see the clearish milky water on the top and then the clumps at the bottom. The one that has the silver coin in it will still have uniformity and usability. So it's quite interesting.
So the brand that we carry here is called Argentin. It is only available through physicians, but the same company that makes Argentin makes a half strength that you can find at a health food store. It is under the brand Sovereign Silver. That's very good as well too. We like Argentin. It comes in several different, mechanisms to get it into you.
A spray, so you can spray it on a
wound, your eyes.
Then eye drops.
Right.
And then it comes as a gel. They mix it in with a gel so you can put it on a wound, and then the liquid.
And that nasal spray.
And yes, a nasal spray, that's right. And I have all of them in my home.
Yep, and we use it with our kids all the time, and especially around allergy season or any kind of throat, mouth, ear, nose infection. It's good stuff. Great. Well, I'm not seeing any questions in the chat just right now. Doctor, anything you want to bring up?
Well, what about Dr. Johnson?
Dr. Johnson, we have been talking to Dr. Johnson for many, many months. He flew out here from the East Coast to visit, and as part of the interview process and getting to know him, he spent some time shadowing our physicians, as we always do with physicians. We really take our time, and it's very important to find the right doctors to join our team. And I'm excited to say that he, after an extensive interviewing process, made the cut. We made an offer out to him, and he is in his car as we speak, driving out here to Southern California. We're expecting him in the area probably sometime next week. And over the course of the next couple of weeks, he'll be shadowing the doctors. He'll be doing training, learning our systems, our EMR. He's going to go through some certification courses. And I expect him to start seeing patients on a limited basis within a couple of weeks.
Wonderful.
Yeah, very excited to have him here.
And doesn't he have an extensive history in joint injections, things like that, ozone injections?
He does. He's had a lot of hands-on therapy with many different types of injection therapy, including intra-articular, which are like your joint injections, cranial. I mean, there's many things that he was describing to me that I wasn't even aware was a thing for both pain and inflammation and healing. So excited to look at that again. We had a very successful ozone joints. What is that called? Oxidative prolozone therapy here for patients. And Dr. Faraj did that. Dr. Faraj isn't with us anymore, so that went away for a time.
And I did that. Dr. Kaur did it. P.A. Patel did it. It's just we were so overwhelmed with the patients that we had to let these more elective things go to the side just to see the volume of patients who other doctors just had closed up to, and we got all that volume to see.
Yes. Cool. I do see a quick question come in here from Christina. She says, "Hi doctors, my 4-year-old has dermatitis on the bottom of his feet. Any natural remedies? Thank you."
Well, often this is like a low-grade fungal, and they're wet and dark, and so I would go straight really for that Argentin spray to spray his feet every night, or her feet every night, and don't let them wear socks or anything like that.
Air it out.
And let it get close to the air. Keep the sugary juices, apple juice, orange juice, all the sugar treats down to a minimum because they love sugar. And see if that won't help the child. Also, essential fatty acids. If the child isn't eating enough healthy, free-range chicken with the skin on it, fish, beef, and egg yolks, the cell membranes break down more easily. Right. So make sure the child is getting plenty of healthy fats in their diet to make the cell membranes as well.
Right. Would you suggest trying an antifungal, a topical antifungal?
No, because Argentin is antifungal.
Right. So if you're a patient of ours, you have access to any of the Argentins. If you're not a patient of ours, look up Sovereign Silver. You can get that from Whole Foods, Mother's, Sprouts, and I'm sure you can purchase that online as well too. Do that topically, air the feet out, cut out sugar and carbs for a time, and get some healthy fats in the diet from egg yolks, beef, chicken.
The other thing I would say is, you know, these tubes that have antibacterial creams in it. So it's a triple antibiotic cream and stuff over the counter. The actual petroleum jellies that they put the antibiotics in are known to inhibit healing of wounds.
Oh.
So I never use them. I never recommend them.
I see. Yeah. Okay. All right. Well, thanks for that question. Next one comes to us from Perry, and she says, he says, what prostate exam tests should a man be given?
What prostate test should he be given? Well, he should, if he has a family history of prostate cancer, I would say by age 40, he should get a PSA, prostate-specific antigen screen. And then I would do that every year or every 2 years. And then you should have a digital rectal exam somewhere in your 40s, and thereafter once or twice every couple years. Okay, so maybe if it all is looking good on the exam, they want to do this rectally and feel the prostate. And if the prostate is hard, that's abnormal. If the prostate is asymmetrical, that's abnormal. If the prostate has hard bumps on it, that's abnormal, and that should be followed more closely. So actual finger in the butt to feel the prostate in a man, maybe the first time around age 40 with a PSA, and depending on the findings, you set up a plan for how often you need to check that. There are ultrasounds you can do. You can get pelvic MRIs with contrast dyes, all these things. But eating pumpkin seeds has that pygium kind of sal palmetto. So and how much? So I would say a couple tablespoons if you eat that several times a week, not just once a week. You got to use it a few times a week. Pumpkin seeds are known to help this. Wine, beer, alcohol. All these things make estrogen go up in a man, and it makes his prostate swell. Sugar, excess high fructose corn syrup, makes the prostate swell. So if you want a healthy prostate, you should avoid alcohol and the sugary foods with the impact of the hormone insulin stimulating growth. You should have your first PSA with the digital rectal exam starting in your early 40s.
Okay. Deborah asks, could you give an overview of the benefits of molecular hydrogen water for people? I just came across this. Molecular hydrogen water.
Water exists in many different forms. So when you think of H2O as water, yes, that's water. But water has, depending if it's just sitting in a jug, it starts to break apart. And then you'll have hydrogen particles, hydroxyl particles, OH, and then this becomes more problematic.
Right.
So running water, even in the Bible, it always talks about running water. Running water is healthy water. There's water where you talk about vortex water, where you sit your water on this plate that's magnetic, and you have this kind of like metal plastic bean in there, and it stirs your water for you. So vortex water is healthier water, and it stops the degeneration of the hydroxyl and the hydrogen particles. Now, there are places where water seems to have compression under the ground and stuff, and the water comes out with additional hydrogen particles in it. These hydrogens are positive ions, okay, and we call them cations. Our bodies are aging, and free radicals are made that are anion negative. And as we age, we get more negative, more anions from breakdown. If you drink water that has more positive ions added to it, okay, and they can do this, all right. Izumi is a company, IZUMI or something like that, is a company that has done a lot of publications on, and I have used this. In fact, I do drink it. Why don't you get me one of them out of the refrigerator, and I can show them this. Izumi is a hydrogen enhanced water. It's on the bottom there. No. Oh, okay, yeah, that's it. Thank you. Izumio. So this is what I drink, IZUMIO. I don't drink it exclusively, but I do add it to my diet. So this is hydrogenized water. And this extra hydrogen ion helps slow aging down. It helps quiet down free radical damage that would hurt the next cell membrane. So if you had a habit of drinking this, and it's in these nice little packages you can take with you, it's yet just another means by which you can slow your aging. Free radical oxidative stress is what it's called. So that's what hydrogen water is.
Okay. Basically, it's like it has a higher antioxidant potential than still stagnant water.
Correct.
Okay.
Yeah.
Great. Blake says, typically, should a pregnant woman take vascuzyme or systemic enzymes in general?
Yes, she can. Yeah, absolutely.
So, of course, and there's different trimesters. So towards the first trimester versus the third trimester, any differences, or do you think systemic enzymes are good for a woman to take while she's... Of course, our body makes systemic enzymes.
We make enzymes all the time, and you're full of them. The need for them is not as much in a younger woman,
right.
Okay? But it keeps you uninflamed. It helps with congestion, joint, the back stiffness, and so forth that you get with pregnancy. So there's nothing wrong with taking systemic enzymes, 3 or 4 on an empty stomach. Absolutely safe.
I know my wife's pregnant right now, and she's due any day. We're very excited. I think that someone had said something to her because she has low platelet counts, iron deficiency, and there was a concern with bleeding around the systemic enzymes. Is that any kind of a concern to you?
I think that's all theoretical.
Okay.
That's all conjectured, okay? if you're trying to say enzymes are blood thinners, they are not blood thinners in the sense of an aspirin or Motrin or Advil, nonsteroidal anti-inflammatories. Those are real blood thinners. But enzymes help work with tissue irritation and inflammation, which we need all the time. So they're really two different categories. There is no, I know there is no study on the risk of this with bleeding at all.
Why do we sometimes tell people to pause their systemic enzymes before or after surgery?
When a patient is going to actually be cut open, you have billions of capillaries. And if you're on enzymes, that can create the little capillary to allow the blood flow. And the surgeon will take his cauterizing agent, and they'll have to just touch these little sites as they ooze, okay? And so that is more common if you have high-dose enzymes as you age. But normally, this is not something that happens. Even when you're having a baby, you're not being cut, inches worth.
Unless you're having a cesarean section.
Unless you're having a cesarean section. And even still, it's not a problem.
Right. Okay. Really quickly, can you just name a couple of supplements that you think are extra important to take while pregnant?
I think Juice Plus is probably the most looked at supplement in healthy babies. In studies with Juice Plus from OBGYN, these OBGYNs looked at how many children had to go on for C-section deliveries. Women had to wind up having a C-section. How many of them went into the neonatal intensive unit? What their birth weights were.
Yep.
And they found all the women, nearly all the women who were on the Juice Plus categorically has way statistically reduced C-sections. They had healthier body weights of the birthed children and less NICU. They didn't have to go to any neonatal intensive care unit.
In short, mother and baby thrived more than the group that was not on Juice Plus.
And so much so that the placentas of the Juice Plus women, they have learned already in many gynecologic delivery rooms, they are pinker, more robust, healthier placentas. And they like to use this for research, the stem cells. So placentas from Juice Plus women are the dream of a pathology research lab. And the other thing is, I think all women who are pregnant should be on at least 5,000 international units of vitamin D. They should be on iodine, 12.5 milligrams to have
for that brain.
Greater intelligent children, and then a good multi-mineral vitamin, which, I'm biased. I think our MD Proven or Mitocore or TLC Energy Core that we designed are very good.
Okay. Thanks, Doc. How about PEOs? Do you think, you could go on and on and on too.
Right.
All these things are great for when being pregnant, but okay, great. So those are some good ones to be on. Juice Plus, iodine, vitamin D, and a healthy, a good multi-mineral, multivitamin.
Mm-hmm.
All right, excellent. It looks like the rest of the comments and questions are just thank yous and happy belated birthday, Talon. Thank you.
Yes, happy birthday.
Turned 40 a couple days ago, and then you had your birthday a few days before that.
And then Dad had his birthday
That
a few
is.
days, and our 50th anniversary.
That's right.
A few days before that.
And any day we're gonna have a new little baby in the
Another
family.
baby in the family.
Exciting.
Yes.
Well, anything you'd like to close us out with, since we're running up on time here and there's no more questions?
Well, Monday night, as always, I'll be
Yes.
here at 6 o'clock. Please get your family and friends.
Mhm.
Any questions you have, you can email them at the link at the bottom and then send it in, and Talon will have that for me
Sure
listed
will.
up. And then I will see you on Monday night. This is to be a time for meeting, a time for getting questions, to lift up our own personal responsibility in our health care. What can we do at home, and these kind of things.
Yep.
So you don't need to see a doctor so much.
Now, Monday is Labor Day, and you will be still doing your labor of love, which is this YouTube Live. So be sure to tune in Monday. That's at 6 o'clock. Dr. Ellithorpe takes a little bit more time. And I do believe, I can't say for certain, but I do believe that there's going to be a very important announcement that you won't want to miss. You want to be live for. There might be some kind of drawing or something like that to be confirmed. To confirm that, you do want to make sure that you're signed up for our email, because that's where it will be announced there. Any kind of promotion for the weekend, you'll want to go to tlcdoctors.com. That's TLC as in tender loving care, doctors, plural.com. Scroll to the bottom. You can sign up for our newsletter right there, and I expect an email is going to be going out soon. Ryan mentioned something possibly about a giveaway for the people that are tuned in live.
Good. All right. Wonderful. Okay. Wonderful.
Well, everyone, thanks for tuning in. If this was helpful, if you like this, do us a favor and just hit that thumbs up button. That's feedback for us that we're doing the right thing here. And you can use the link in the description to submit questions 24/7 anytime. You can also submit ideas if there's a particular topic. Maybe you don't have a specific question. Tell us what you'd like to hear Dr. Ellithorpe talk on or teach on, and we'd appreciate that. All right, everyone. Well, have a wonderful, long 3-day weekend, hopefully, and we will see you here on Monday at 6 o'clock p.m. All right, be well.
God bless.